Hi everyone, thank you for being with us today. Today we have a social worker. Her name is Haley. She's going to be answering some questions about her profession with us. So Haley, can you do a quick intro about yourself?
Sure. My name is Haley Trent. I'm a licensed clinical social worker, and I work. Should I tell her where I work for? Or no? Okay. Yeah, I'm a licensed clinical social worker.
Okay. Let's start with the first question here. What is the process of becoming a social worker?
Well, first you need to get your bachelor's in any profession, whether it's psychology or social work, anything. And then you go into your master's program and you get your master's in social work. Then after that, if you wanted to become a clinical social worker, a clinical licensed social worker, then you would need to accrue some hours and then take a test to be certified to become licensed.
Okay. As a social worker, what is your scope of practice regarding the services that you provide?
So just basically speaking, you would meet with the patient for the first time and you would assess where their functioning is at, what their needs are. Are they in a state of crisis? Basically working with client-centered interventions to help them develop some goals for themselves. That's what I do.
And just to follow up on that, what is the typical client you work with? Do you work with all like young to old, or like you have a certain group that you usually work with?
So in my career, I've worked with gerontology. Then I went to work with adolescents for 7-8 years, and I currently now I see adults and families and couples currently.
And what are your primary goals? I know you talked about it a little bit, but what are your primary goals for your clients when you're meeting with them?
So it depends on where I'm working. If it's in my private practice, then our goals are more self-actualization versus if I'm in a more acute setting, then it would be crisis, or it would be just symptoms management if they have like severe mental illness.
Okay. And in what different types of settings can you find social workers at?
So anywhere. My type of social work is clinical, so it's more therapy. But you can find social workers in schools, in hospitals. Social service social workers is probably the most well-known. In any kind of health setting.
So those would be like traditional settings. Are there any non-traditional settings that social workers work in?
Private practice, schools. I think I mentioned schools, hospitals.
So Haley, what are some professions that you collaborate or work with?
I work with social workers, I've worked with teachers, I've worked with psychiatrists, behavioral therapists, even ABA coaches. I've worked with occupational therapists, physical therapists, doctors, a wide variety.
Oh wow, that's a lot. What is your favorite profession that you collaborate with?
My favorite collaboration would probably, it's a tough one. Okay. I would say occupational, and I'm not just saying that because I think we have the same goal of kind of helping them transition back to their pre-morbid state of functioning, right?
Yeah.
And their overall wellness. You know, I think a lot of collaborators don't understand the mental health and how it affects a person's functioning. So that's a little bit difficult, but I feel like with an occupational therapist, they understand and we kind of have the same goal for the patient.
Yeah, that makes sense. How might you collaborate with an occupational therapist?
So different settings. I've worked in an adult day health care where we were all part of a team. So we would work together to address every part of that patient, whether it's their physical therapy, it's their occupational therapy, their mental health being, their medical being with nurses. And then I've worked in a community mental health settings where we have kids that are referred by schools,
Mhm.
and they may have some special disability that, because of their disability and because they can't function like other kids at their age, they're going to need the help of a clinical therapist, a social worker, to help them adapt, adjust, transition.
Yeah. Oh, okay. And has an OT ever referred clients to you?
No, not that I can think of. Well, except if we were on a team together where I was previously working. So yes, that patient came, but they were referred to all of us. So they got all of us to wrap around them.
Oh, okay.
But I haven't had an OT. I think the OT would probably go to their primary care first, and then to us, or the OT would refer to the IEP, individual, IEP services, and then they'll pull us into the services for the kids.
Oh, okay. And what are situations in which an OT would refer clients to a social worker?
Well, like I think sort of similar to what I said earlier. Let's say you have a patient that has just been in an accident, and they were very high functioning. So this is a very dramatic, traumatic experience that they just went through.
Yeah.
So they would call us to come in and help them. Well, to assess, are there special needs they may need? Are there some services like family therapy they may need to help the family to adjust to this new change? The patient needs some therapy to help them, because when you go through something that devastating, right? There probably is some depression and some anxiety, because you don't know how your life is going to be after what has happened. So,
Okay. That's it. Thank you so much for your time and answering all of our questions.
Not a problem. My pleasure.
So thank you guys for joining us again. We're just gonna talk about what we learned from the interview with Haley, the social worker. So Luana, what did you think about it?
I found it incredibly interesting. There's a lot of things that I learned that I didn't know about social workers prior to going in to interview her. I found it also really interesting, like all the professions that social workers had to collaborate with.
Yeah, so she's mentioned with doctors, with physical therapists, coaches, and OTs also. So yeah, it's a lot of different professions that they work with. They also work in different settings too, right? She mentioned the school setting, community-based settings, and also in the clinics and private practice, which is where she's at right now. So it was interesting to see the wide range of settings that they do work in.
And I really like peeking into her rooms and seeing like the setting is different, like seeing like couches in there. And
couches, yeah, it's like furnished like a house,
like
right?
a house.
To make the client feel more comfortable. So that was pretty interesting.
Yeah. I also found out that they had really similar principles to occupational therapy.
Yeah, there was a couple that she mentioned, like she's the social work is client-centered, she mentioned, and also she likes to focus on the client's self-actualization when she has them in therapy. So similar principles to OT there.
Yeah, and they touch on like mental health, which is where like OT first started, so that was really interesting. I also found it really interesting that she said that in school they teach you how to compartmentalize your feelings, so you're not like super emotional when you're working with like kids or like anybody that.
And we can actually learn from that too. As OTs, you're gonna encounter clients, and so when you're building rapport, you're gonna be attached to some clients. So we gotta be able to compartmentalize those feelings also. So
yeah, definitely.
Good thing to learn from the social workers.
And I think the most interesting and fun fact I learned from the interview was how she actually works with couples, and that's her least favorite like type of I don't know what the word is.
Type of like therapy she does.
Yeah.
It was interesting. When I first came in, I had one view as social workers, which is like maybe they work with like kids with family problems and stuff like that. But she really opened up our eyes to the field and how wide their scope of practice is.
Yeah, definitely.
Right. Thank you guys for joining us. Hope you guys enjoyed the video.